Kidney failure is one of the most dangerous health conditions because it often grows silently inside the body without clear warning signs until serious damage has already occurred. The kidneys are two small organs shaped like beans that sit on each side of the spine, and their main job is to filter waste and excess fluid from the blood. They also help control blood pressure, balance minerals, produce hormones that support red blood cell production, and keep bones strong. When the kidneys begin to fail, these vital functions slowly weaken and toxins start to build up in the bloodstream. This process can take months or even years, and many people do not realize anything is wrong until they feel extreme fatigue, swelling, or pain. Because of this hidden progress, kidney failure is often called a silent killer. The body depends on the kidneys to maintain balance in nearly every system. Each day, large amounts of blood pass through them and waste products are removed through urine. When kidney function drops, the blood becomes polluted with substances that should be removed. This can lead to nausea, loss of appetite, headaches, muscle weakness, and mental confusion. Fluid that should be expelled may stay inside the body and cause swelling in the feet, ankles, face, or hands. Blood pressure often rises because the kidneys help regulate it, and when they are damaged, this control is lost. Over time, high blood pressure can damage the heart and brain and create a cycle where kidney failure worsens heart disease and heart disease worsens kidney failure. One of the biggest dangers of kidney failure is that the early stages show very mild symptoms or none at all. A person may feel normal or only slightly tired and assume it is due to stress or age. Minor changes in urination, such as going more often at night or noticing foamy urine, may be ignored. Foamy urine can be a sign that protein is leaking into the urine, which shows kidney damage. As the disease advances, people may notice swelling around the eyes or in the legs. Skin may become dry and itchy. Appetite may drop and weight may change without reason. These signs are often mistaken for simple problems and medical care is delayed. The causes of kidney failure are many and often linked to modern lifestyle habits. Diabetes is one of the leading causes. High blood sugar damages the tiny blood vessels in the kidneys and reduces their ability to filter waste. Over years, this damage becomes severe. High blood pressure is another major cause because it puts constant strain on kidney vessels and slowly destroys them. Long-term use of painkillers, especially without medical advice, can also harm kidney tissue. Infections that affect the kidneys can leave scars that reduce function. Autoimmune diseases can cause the body to attack its own kidney cells. Dehydration over long periods may also reduce kidney performance. Even exposure to toxic chemicals can lead to kidney injury. Diet plays a strong role in kidney health. A diet high in salt increases blood pressure and strains the kidneys. Too much protein can also be hard for damaged kidneys to process because protein waste products must be filtered out. Excess sugar contributes to diabetes, which harms kidney tissue. Processed foods often contain additives and preservatives that increase the workload of the kidneys. When people drink too little water, toxins remain in the body longer and the kidneys struggle to flush them out. A healthy kidney thrives on balance with enough fluids, natural foods, and limited salt and sugar. As kidney failure progresses, the body enters a state where waste and fluid overload disturb every system. The heart may enlarge due to fluid retention. The lungs may fill with fluid and cause breathing problems. Electrolytes such as potassium may rise to dangerous levels, and this can affect heart rhythm and lead to sudden cardiac arrest. Bone health weakens because the kidneys help regulate calcium and vitamin D. Without this control, bones may become fragile and painful. Red blood cell production drops because the kidneys produce a hormone that stimulates bone marrow. This leads to anemia, which causes weakness, dizziness, and shortness of breath. The mind can also be affected because toxins in the blood interfere with brain function, leading to poor concentration and memory loss. There are different stages of kidney failure, and each stage represents a decrease in how well the kidneys filter blood. In early stages, simple lifestyle changes and medication can slow the damage. In later stages, the kidneys lose most of their function and the body cannot survive without medical support. At this point, dialysis or kidney transplant becomes necessary. Dialysis is a treatment that removes waste and excess fluid from the blood using a machine or special fluid in the abdomen. It must be done several times a week and can take many hours. It keeps people alive, but it is not a cure. A kidney transplant replaces the damaged kidney with a healthy one from a donor. This can greatly improve quality of life, but requires surgery and lifelong medication to prevent rejection. The emotional impact of kidney failure is often overlooked. Living with a chronic disease can cause fear, depression, and stress. The need for frequent medical visits and treatments can disrupt work and family life. Many patients feel like they have lost control over their body. This emotional burden can weaken motivation to follow diet plans or take medicines properly. Support from family and health professionals is very important. Education about the disease helps patients understand what is happening and gives them power to make better choices. Prevention is the most powerful tool against kidney failure. Regular health checkups can detect early signs such as protein in urine or high creatinine levels in blood. Managing blood sugar and blood pressure is critical for those with diabetes or hypertension. Drinking enough clean water helps flush waste from the body. Limiting salt, sugar, and processed food reduces strain on the kidneys. Eating fruits, vegetables, whole grains, and healthy fats supports overall health. Avoiding unnecessary painkillers and harmful substances protects kidney tissue. Physical activity improves circulation and helps control weight, which reduces the risk of diabetes and high blood pressure. Public awareness about kidney failure remains low even though it affects millions of people worldwide. Many individuals think kidney disease only happens to old people or those already sick. In reality, anyone can develop kidney problems due to lifestyle or genetic factors. Early education in schools and communities can teach people the importance of hydration, healthy diet, and regular testing. Media can play a role in showing real stories of people who ignored symptoms and suffered severe consequences. When people understand that kidney failure can progress quietly, they may be more willing to take preventive steps. The term silent killer is used because kidney failure rarely screams for attention in its early phase. It whispers through subtle signs like tiredness, mild swelling, or slight changes in urine. These whispers are easy to ignore, but they carry a serious message. When the disease reaches an advanced stage, it becomes loud through pain, breathlessness, and severe weakness. By then, much damage has already occurred. This is why listening to the body and seeking medical advice for small changes is essential. Medical science continues to research better treatments for kidney disease. New drugs aim to protect kidney cells and reduce inflammation. Artificial kidneys and improved dialysis machines are being developed to make life easier for patients. Scientists are also studying stem cell therapy to repair damaged kidney tissue. While these advances offer hope, they do not replace the importance of prevention and early care. A healthy lifestyle remains the strongest defense against kidney failure. Family history also matters because some kidney diseases are inherited. People with relatives who had kidney failure should be extra cautious and get regular tests. Pregnancy can sometimes reveal kidney problems because the body is under extra strain. Infections that cause fever and pain during urination should never be ignored because they may spread to the kidneys. Treating them early can prevent long-term damage. Another factor that contributes to kidney damage is lack of sleep and chronic stress. Stress hormones raise blood pressure and blood sugar, which harm the kidneys over time. Poor sleep affects metabolism and increases inflammation. Together they create conditions that favor disease. Learning to manage stress through relaxation, exercise, and proper rest can indirectly protect kidney health. The role of water in kidney function cannot be overstated. Water helps dissolve waste and allows it to be excreted through urine. When the body is dehydrated, urine becomes concentrated and waste products stay longer in the kidneys. This can lead to stones and infections and over time damage kidney tissue. However, excessive water intake without balance can also stress the kidneys. The goal is steady hydration based on body needs and climate. Cultural habits can influence kidney health. Some traditional medicines contain heavy metals or unknown substances that may be toxic to the kidneys. It is important to use medicines only under professional guidance. Alcohol in large amounts can dehydrate the body and increase blood pressure, which harms kidneys. Smoking reduces blood flow to the kidneys and speeds up loss of function. Quitting smoking improves circulation and lowers risk of kidney disease progression. When kidney failure is diagnosed early, the journey can still be managed with discipline and care. Patients can slow progression by following diet plans that control protein, salt, and potassium intake. Medications can reduce blood pressure and protect kidney vessels. Monitoring weight and swelling helps detect fluid overload. Keeping track of lab values helps guide treatment. This active involvement in care gives patients a sense of control and improves outcomes. In advanced kidney failure, life changes drastically. Dialysis schedules shape daily routines. Food and fluid restrictions become strict. Travel and social life may be limited. Despite this, many patients find ways to live meaningful lives by adjusting expectations and finding support. Stories of resilience show that while kidney failure is serious, it does not remove the value of life. Education is needed not only for patients but also for the general population. Understanding that kidneys are not just organs for urination but vital for balance of the entire body can change attitudes. Simple habits like checking blood pressure, drinking enough water, and eating fresh food can be promoted as kidney-friendly actions. Health campaigns can focus on the idea that protecting the kidneys protects the heart, brain, and bones as well. Kidney failure is not a sudden enemy in most cases. It is usually the result of years of neglect or unrecognized damage. The silent nature of the disease makes it dangerous but also gives an opportunity because early damage can be slowed or stopped. The body gives small signs and modern medicine offers tools to detect them. The responsibility lies in paying attention and taking action. Did you know you have 2 tireless workers in your body, operating 24/7 without a single complaint? I'm talking about your kidneys. Every minute, they're filtering your blood, adjusting to your body's needs, and keeping everything in balance. But here's the scary part. When they start to fail, they don't scream in pain. They just quietly slow down. This silent decline is why kidney failure is often called a silent killer. It can hide behind things you might ignore, like everyday fatigue or small, seemingly minor changes. By the time symptoms are obvious, it could be a life-threatening crisis. It's a sobering thought, but one we all need to hear. The future of kidney health isn't just about advanced medical treatments. The biggest victory is preventing the disease from ever getting serious. This starts with us. It means valuing routine checkups, even when you feel fine, and making healthier daily choices. It also means families supporting each other in creating healthy habits, and communities ensuring access to clean water and nutritious food. What we do every single day shapes our long-term health. Simple choices, like drinking more water instead of sugary sodas, or taking a short walk instead of sitting for hours, have a huge impact. These actions influence your blood pressure, sugar levels, and circulation, all of which directly affect your kidneys. Health isn't just built in hospitals, it's built in our kitchens, our workplaces, and our daily routines. Ultimately, kidney failure is a reflection of an overall imbalance in the body. It shows just how interconnected our organs are. When one system struggles, it can throw everything else off. That silent killer doesn't just appear overnight, it grows over time. Recognizing the early signs can turn a potentially fatal path into a manageable condition. Protecting your kidneys means protecting your life. Without their quiet, constant work, our bodies can't cleanse themselves or maintain that delicate harmony. The message is simple but powerful. Awareness leads to prevention, and prevention leads to survival. Thanks for watching. Please like, share, and subscribe for more content to help you stay healthy.